Good afternoon. My name is Caroline Naji. I'm a student at Allegheny College of Maryland. Today, I am here to manage review medication and also do discharge teaching for Mr. JD, who is 5 years old, 45 years old male, who is recently diagnosed with type 2 diabetes and hypertension after being admitted in the hospital with severe symptoms. So today goal for me is to help Mr. JD and his spouse safely and manage their condition at home and prevent more complication. Mr. JD present today in emergency room with frequent urination and hunger and blue vision and confusion. So his blood glucose level was critically high upon admitted, and his blood pressure was 188 over 120. This finding immediately was was the reason why he was medically admitted, hospitalized. So today goal is for me to make him understand his diagnosis of type 2 diabetes occurrence when the body becomes consistent or resistant to insulin or causing more sugar resistant level. If properly managed, it can lead to a lot of complications like nerve damage. It can also cause cardiovascular problems and diabetes issues. So today, I am going to help with how he can also manage his hypertension, further increase risk of heart attack and stroke, and also manage uh, medication is essential. So on the medications, I'm going to review his home medications like um his home medication. He's currently taking uh levothyroxine 100 milligram or PO daily, which used to treat for hypothyroidism hormone replacement. So today he takes this medication once in a day in the morning, and he's supposed to take the medication with empty stomach um 30 minutes to 60 minutes before breakfast. So today he also supposed to take the medication with a full glass of water, avoid calcium or iron or anti-acid while he's taking all this medication. Expectation outcome for this medication is to improve his level of metabolism and also his normal thyroid function. The other medication that he also takes at home is protoline, which help to reduce his stomach acid for gouge. Before taking, he's supposed to take this medication before meal, before breakfast. Swallowing a whole or do not quash. You have to take the medication a whole. Do not quash the medication. This medication will help to reduce the heartburn, diarrhea, abdominal pain. So he respond to his provider. He, if you have any severe diarrhea or abdominal pain, any sign of symptom of like uh irregular heartbeat, he should needs to report back to his doctor. Another medication that he's going to be going home today is metformin, which is going to help him to manage his diabetes. This medication will help to lower his blood glucose and improve his insulin. And also, uh, this medication help to decrease glucose level produced in the liver. So he take this medication to help. So some of the side effect of this medication will be stomach upset. uh, as soon as you start taking it, it's gradually as you're taking the medication, gradually as the week progress, the medication symptoms reduces. Other side effect of the medication is nausea, diarrhea, abdominal discomfort, which often will improve as time goes on. So this teaching, this other medication, some of the side effects you should also look at is lactose acidosis, or which is also rare, and report to your provider if those symptoms occurred. So some of other thing is to another for medication is metoprolol, which is naproxen. The purpose of this medication is also to lower blood pressure and heart reduce irregular heartbeat. The risk and complication is to take this medication. How to take the medication? Uh, take the medication without food. Do not stop the medication suddenly. The expected outcome for this medication is uh the expectation eh, the expectation outcome is to lower blood pressure and control heart rate. The other side effect is fatigue, and uh dizziness and slow heart rate. So the patient, when he gets up in the morning, he slowly gets up. Before he get up from the bed, he should not just jump up from the bed. He should slowly get up and sit down and gently get up. He should not just suddenly get up from his bed. That will cause dizziness. So another medication that we are going to look at is lisinopril. Lisinopril is take the lisinopril 10 milligram. The purpose of this medication is also to lower blood pressure and help protect the essential diabetes also. This medication, you should take it daily, and it may also with or without food. The expectation outcome for this medication is to reduce high blood pressure and kidney protection. It protects the kidney. Some of the other side effects is dry mouth, dizziness, headache. Some changes of position should also slow down when you're getting up from the bed or getting up from the chair. So another side effect to report to the doctor, because the medication angioedema. If you have any swelling of lips or of the face, you should report to your doctor immediately. Or persistent cough that does not go away. So today, um the general medication review is to take this medication safely at home, so that my patient will not be able to return back with the same symptoms, and also let Mr. JD not to escape this medication. As if he has any issue, he should report to the provider, and also contact his pharmacy if he's confused of the medication, and also avoid over-the-counter medication without doctor's approval. So today, I have safely reviewed the medication with the spouse, and I have also verbalized and the spouse understand and the time. And I also have also let the spouse to use medication organizer to organize dates and time of how the medication should be taken, so that my patient will not be able to skip those medications. So my patient had demonstrate with her spouse, had demonstrated and understand that how to take the medication, and also has how to do the medication management. Thank you so much for listening.